Welcome to today's webinar on gathering credible evidence and data collection methods with a focus on quantitative data. This is brought to you by the AIM Local Health Project, a research project out of the Prevention Research Center at Washington University in St. Louis. The project is funded by the National Institutes of Health. Hi, I'm Renee Parks. I'm the project manager for AIM Local Health and the host and one of the presenters on today's webinar. Just like the previous webinars, this one will be recorded and you will get an email in the next day or so with information on where you can access the webinar recording and the accompanying materials. This Evaluation Fundamentals webinar series was developed by the Prevention Research Center in partnership with the Brown School Evaluation Center at Washington University and Research and Evaluation at NACCHO. The goal is to equip you with the skills and confidence to develop or enhance your program's evaluation plans. Because of your participation in today's evaluation webinar, I feel confident that you're aware of this 6-part series. However, I'm not so sure about your awareness of the other opportunity part of this evaluation capacity building. I'm referring to the evaluation plan technical assistance. And this is available to those who complete the webinars 1 through 4 and eventually complete webinar 6. The TA can include guidance with process and outcome objectives and their indicators, fine-tuning your program's logic model, data collection methods and plan, and your dissemination plan. The consultants for this technical assistance are either the Brown School Evaluation Center, NACCHO, or the Prevention Research Center. And you can take advantage of this TA opportunity as early as late September through the end of the project, which is February of 2020. And there's no limit to how many programs receive technical assistance from your health department. And you're able to request your technical assistance through that online form, the link on the screen, which will be included in the follow-up email in this webinar. We really don't want you to miss out on this opportunity for support along this kind of complex process. All right, I know many of you are familiar with Zoom settings, so I kind of quickly want to go through this. So on the bottom left of your Zoom window, you have the audio settings. This is how you can adjust those settings. And just so you know, you're currently muted. In the bottom middle is the chat feature and the raise hand feature, which I have highlighted here. Yeah, right there. And then finally, there's the Q&A panel. So you can submit questions or comments throughout this webinar. We will address them at various portions throughout the presentation. And then at the top, you have the View Options menu where you can adjust your Zoom viewing window. All right, everyone, let's use that raise hand feature. I'm curious to know how many of you plan on using or taking advantage of the evaluation plan technical assistance that I just was talking about on the previous screen. So let's see a show of hands. I'm seeing several participants. Okay, that's good. I know some of you are paying attention and hopefully will take advantage of that technical assistance opportunity. Great. All right, you can go ahead and lower your hand and we're gonna move on. So we have several presenters for today's webinar. Joining me is Peg Allen, who's an assistant professor with the Brown School, and she's also faculty with the Prevention Research Center and a member of the AIM Local Health Project team. Peg has been working with state and local health departments since the 1980s, mostly in school health, tobacco, physical activity, and other aspects of chronic disease prevention. And then we also have Rebecca Jacob. She's a research manager with the Prevention Research Center. Her work in research and evaluation has stretched across several areas and sectors, including maternal and child health, mental health and homelessness, cancer screening and prevention, evidence-based public health, and public media community impact. We're so glad to have both Rebecca and Peg joining us. And then I will also be presenting, and I think I've shared this already, but prior to my position here at the PRC, I've been working in health promotion and prevention initiatives broadly across various sectors, and that was for the past 12 years or so. Okay, I'm going to say goodbye to you, this video component, and I'm going to have you focus in on the slides because I can be kind of distracting with my hands raised and everything else, and I really want you to focus in on the content. All right, so we're coming back to this evaluation framework or wheel that was introduced by Nancy Miller from the Brown School Evaluation Center back in webinar 1. It's our guidepost throughout the series, and it's really helping us to ensure that, you know, the evaluation activities and results that we get from our evaluations that we're conducting are useful, feasible, suitable to the evaluation need, and accurate. For today's webinar, we're still hanging out on the evaluation planning and design side, and we're touching a little bit and describe the program and then diving into data collection methods. These are our goals for you today. We've got several of them, and hopefully we'll quickly get through all the content that we have for you. Our agenda, we've kind of divided it up into 3 parts, starting with objectives and indicators, and then moving into common sources for quantitative data, and with the largest chunk of time devoted to the survey approach. All right, so goals, objectives, and indicators. Oh my gosh, embarking on this process can sometimes be, I don't know, a little terrifying. That might be a little dramatic, but maybe it's more anxiety provoking, and probably at the same time, a lot of fun and rewarding. And I sure hope it's the latter for you. This figure is to acquaint you with the elements of the evaluation planning process that we've touched upon. And you can see where the program goals, objectives, and indicators fit in that process. You are likely to have already set your program goals and objectives, which are flowing out of your priority areas and focus. Your goals and objectives are, of course, very essential in the program planning process, and they establish the criteria and standards against which you can determine your program performance. As you know, and we've been emphasizing throughout this webinar series, engaging stakeholders is key throughout this process, and it's so beneficial to engage them in the development of your program goals and objectives, or at a minimum, share those with those stakeholders so you can really maximize the contribution of these stakeholders in working towards those goals and objectives. And with your goals and objectives already in place, you will need to identify the objectives related to the program component or intervention that you plan to evaluate. All right, I just want to do a little bit of level setting, and we're just going to quickly touch on this slide. A goal is that broad statement about the long-term expectation of what should happen as a result of your program. And it has those 2 components at a minimum. Some examples are on your slide. Think, you know, broad statements: reduce the rate of teenage pregnancies, reduce the use of marijuana and alcohol use by youth. Objectives are more immediate than goals. They are the mileposts you will pass along the way to achieving those program goals. And because objectives detail program activities, you usually need multiple objectives to address a single goal. SMART objectives, when well written, are really that first step in being able to evaluate progress. And I know most of you are familiar with the SMART acronym, but just to quickly hit upon it, the S being for specific, the who, what, and where. And measurable, so how much change is expected. Achievable, is this realistic given your resources and planned implementation of the program? Is it relevant? Is it in line with your program's goals? And reasonable with the programmatic steps that can be implemented during that specific time frame. And then finally, time bound. This is the, you know, that time frame of when. I really encourage you to revisit the objectives that you already have in place. Could they be smarter? Could they be fine-tuned or tweaked? All right. There are 2 different types of objectives: process and outcome. Process is related to what you are doing and how it will be accomplished, your action strategies. For example, by the certain time frame, conduct an outreach or education campaign with legislators on the importance of physical activity to garner support from a minimum of 10 legislators. Whereas outcome objectives are related to the intended effect of the program in the target population, or the end result of the program. And you're going to have short-term, intermediate, and long-term outcome objectives. And you can kind of see, we've already talked about this in webinar 2, so I don't want to spend too much time outlining that information. But I did want to include a couple examples, one process objective and one outcome objective. So that process objective, by this time frame, public health staff will meet with a percentage of primary care providers identified as high prescribers of opioids to discuss the CDC checklist and training opportunities. And then an outcome objective, by this time frame, X% of providers in the county will incorporate the use of the CDC checklist into their practice. So it just gives you a little example of process versus outcome. Let's switch gears and talk some about indicators, the markers of progress or accomplishment. An indicator is a specific observable and measurable accomplishment or change that shows the progress made toward achieving a specific output or outcome in your logic model. They can be seen, so observed behavior, heard, talking about participant responses, and that could be through a survey or through interviews or focus groups, or read, thinking about your agency documents or records. Some commonly used indicators include participation rates, attitudes, individual behaviors, community norms, health status, incidence, and prevalence. The indicators you select should answer your evaluation questions and help you determine whether your program objectives have been achieved. And indicators can be developed for activities, so process indicators, and for outcomes, so outcome indicators. And there can be more than one indicator for each activity or outcome. It really should be focused and must measure an important dimension of the activity or outcome. And you may need to develop your own indicators, or you may be able to draw on existing indicators developed by others. I did include an example on the slide here. Having good indicators is important. So how do you go about identifying appropriate indicators? Well, you'll want to involve your program stakeholders in this process or this discussion. You'll need to review, of course, your evaluation questions and use your logic model so you can develop a list of possible indicators that then you can review to ensure are specific, observable, and measurable. And you really should consider any indicators used in previous similar efforts and possibly even conduct a quick literature search. And don't forget to include baseline data for inputs or outcomes if you're really trying to measure a change. And then, of course, you'll want to determine if the indicators are really providing useful information. Are they answering your questions? Is it feasible? You know, is the data available, or can it be available or collected in a timely manner with the resources that you have or that your stakeholders are able to provide as well? And then, are they adequate in number to really capture the measures that you need? I included this resource at the bottom. This checklist is it's a very extensive resource on indicators. And it's really helpful to use at really the earliest stages of planning to inform and spark discussion regarding options for indicators. And I wanted to mention the connection of performance measures and indicators and evaluation. So a performance measure is an indicator used to assess how well something is achieving the desired objectives. These indicators can be linked to outputs, the outputs component of your logic model, and can give you a notion of where things may stand and how to improve performance. I know there's an example on your slide here. Another example, so let's think through this activity of implementing a text line for youth to answer questions and receive answers about sex and sexual health. Some possible performance indicators could be the number of questions submitted on a monthly basis, and the amount of time to respond to those questions. Performance measures only partially determine what's going on in a program. Therefore, collecting data on performance measures alone does not constitute evaluation. To have a complete picture of what's happening with the program and answer the whys and the hows, you really need to conduct evaluation. All right, so I really wanted to pull a lot of this info together in an example, and I'm really going to go back to the example that I shared in webinar 2 from the Spokane Regional Health District, their walking school bus initiative in the Spokane public schools. So their goal is to increase the number of students who walk and bike to school to improve childhood health. And here are a couple of their objectives. I just pulled some. So they're really wanting to have 40% of the elementary schools implementing the walking school bus by that specific time frame. And then just thinking more short term, by the completion of the walking school bus program implementation, which is like a 9-week period, they want to have 80% of parents report that the walking school bus increased physical activity, and a greater percentage of students in the walk zone. So they really don't have any baseline data for that, so they don't have that specific percentage there, but they will have that soon. And then you can see their indicators to really get at achieving those objectives, or helping to not achieve, but measure progress of those objectives. And then I pulled this, again, this is from webinar 2. I really think this matrix is a helpful tool in not only thinking through your evaluation questions, but really how are you going to answer those questions? Hence the indicators. So you can, with this matrix, you can see the different components, the evaluation question, the sample indicators, and then it even goes into the sources, the methods, and time frame for data collection. I would also encourage you to consider making an indicator reference sheet. This is really the info needed to make it as clear as possible for data collection and analysis. It's really to ensure everyone is using the same definitions, the same units of measurement, helps everyone understand the indicators, and really tracks the most significant program elements or achievements. Ensures that those chosen indicators will assist in appropriate decision-making or action planning. And some of those elements to consider that are not on here, so I know we've talked about the program measure, but really having that operational definition, having the data source and tools listed, the responsible party or parties, your baseline, and then as well as that target. Those are kind of a good start to that indicator reference sheet. Okay, I'm going to go ahead and turn it over to Peg, who's going to talk about common sources of data.
Thanks, Renee. Hi, everyone. It's great to be with you today. We're going to look at 4 common sources of quantitative data that are listed here. This slide provides links to a few of the many databases that provide background and surveillance information. There's a lot on this slide, so it's a good one to go ahead and print and peruse later. These types of databases are especially useful for assessing community needs and justifying and planning programs. However, these sources tend to be less useful to address our key program evaluation questions, since it's pretty rare that any of our programs are intended to impact citywide or countywide changes. Still, it can be good to check these every few years to see if needs have changed. And one example that we'd like to point out is Explore Missouri Health, which is a good one to check out if you're not yet familiar with it, because it pulls in national census data and other data from multiple sources for Missouri counties, and some information is available at the zip code level, and it's pretty user-friendly. Looking now at documents, Documents can have both quantitative and qualitative information, but quantitative examples would include looking at information about our own agencies that affect the program that is being evaluated. One example is staff turnover. Another example is having information on trainings completed for emergency preparedness, or meeting minutes, or other reports. Reports developed by other organizations can also be very useful. So one example is education department reports that have school district level data on attendance rates or enforcement of a tobacco-free campus policy. And another example would be partner clinics' HPV immunization completion rates. So each data source does have advantages and disadvantages. Existing databases and documents can be easy to gather, and they're great in that they can provide information not available through surveys or interviews and can save us a lot of time that way. A common downside, though, as previously mentioned, the available information may or may not help us really answer some of our key evaluation questions. So moving now to observations, these are great. It's a great tool because we can design our observations to directly address our evaluation questions. Observation can be qualitative or quantitative or both. This slide shows a few examples where observers use forms and checklists to record information numerically. And we use observation in both process and outcome evaluation. One example would be, imagine your health department is a member of an obesity prevention coalition that is working to increase physical activity opportunities. And the Parks and Rec department has committed to improving park paths as part of the overall coalition's effort. Process evaluation could include observation of the condition of the park paths and signage to learn how well the improvement efforts are going. Intermediate term outcome evaluation could include pre and post observations of the number of path users and types of activities that the users are doing on the park paths. Advantages of observation include that they are low cost and that staff and volunteers enjoy doing it. And importantly, we often gain insights that we do not get from surveys. One example is discovering that the reason that no one is using a playground is because it's in disrepair. And we wouldn't have known that without boots on the ground observation. Downsides include the time they take and that different observers might rate the same place or event differently. But a way to minimize that is to do pilot observations until the observers mostly agree with each other. Moving now to surveys, which we use a lot in both process and outcome evaluation, we can learn a number of things from people's self-report, such as how training content delivery went, people's perceptions, say, of neighborhood conditions, awareness of a new policy, knowledge about healthy eating, behaviors such as tobacco use, alcohol use, or self-reported skill levels, or satisfaction with a training, or satisfaction with a new policy or procedure. A major advantage of surveys is that both adults and youth are used to giving their opinions and views and reporting behaviors in surveys. So we can often get the kind of information that we want. Also, they're inexpensive and pretty straightforward to summarize responses. Regarding disadvantages, the survey limitations listed here can be minimized by using questions others have already developed and pre-testing any survey questions we needed to develop ourselves. Rebecca can show us how to prevent such pitfalls while addressing survey processes. On to you now, Rebecca.
Hi all, this is Rebecca. Real quick, Renee, did you see that we had a question come through and it looked like maybe it was one that you could answer?
Yeah, I just saw that now. Thanks, Rebecca. So if the outcome we seek to measure is use of the checklist by a certain number of providers, why is there a need for indicators? Well, sometimes it's and it goes on to say we just need to know how many providers are using the checklist, right? Well, the objective would be to to have a certain percentage of providers use the checklist, yes, and the indicator is to go back and actually find out how many providers are using that checklist. Is that clear? Perhaps. I'm going to turn it over to you.
Okay. Okay. Hi all, this is Rebecca, and I apologize ahead of time. I got a little cold over the weekend, so my voice is a little bit cracky, so hopefully we can get through this. You can hear me okay. You can turn me up if you need to. So I'm going to talk to you today about the survey approach, and I'm sure several of you have done surveys at some point, and I really think whether you've done 1 or 100 surveys, it's really helpful to go through these steps one by one as you're starting the survey process. So hopefully this is really helpful for you all. And if you have any questions as we go through, like we just did, you can just send it and we'll try to address that as we go. So here's the 9 steps that we'll cover today. And the first one, oops, we click over. Okay. So the first thing that you want to do is define the goal of your survey. So you can kind of think of this as like a headliner. So maybe just a 1-sentence headliner that tells what you're wanting to do with this survey. So it could be something like, our survey will assess public opinion of tobacco usage in indoor public places. Just something so that everybody's really on the same page of the purpose. And then of course you want to communicate this goal to your respondents. So whether it's in the invitation to a survey, maybe the introductory text of a survey or your script. And then kind of while you're deciding on the goal of your survey, and this also kind of goes into the design of the survey, you might need to think through if you're going to need to know who your participants are. So if it's a pre-post type of a survey, you may need to know who your participants are. Versus just a general perceptions type survey where you could maybe be okay with anonymous participation. So just something to think about. The next thing you want to do is define your participants. So oftentimes when we come up with the purpose of our survey or the goal of our survey, this is pretty much clear. But if it's not, make sure that it's crystal clear. And it could be a couple different groups. It doesn't have to be just one. But it's really important to know who your participants are because it often dictates what type of survey you'll go about using or go about collecting. And some other things to consider are just the knowledge of your participants of the topic that you're going to ask them about, their preferred language, if they have their accessibility, to a computer or a phone, and your accessibility to their contact information. Do you have their email address, their phone number? Do you know who it is? And then the next thing we want to do, which like I just said, kind of makes you think about how you want to do your survey, you want to pick your platform. So this slide has a lot going on, and I would suggest maybe later printing it as a good reference just to look at the different pros and cons of each type. But I'll just kind of hit the highlights. So for the paper surveys, the ones that you would give to a participant in person, those you really want to think about for somewhere where you want to capture somebody at an event. So it might be at the end of a training, or it might be at a community event. It might be that you have someone at a clinic. So this would be either administered by a staff member, and or it could be that the participant fills it out themselves. And if it's a training or something, you can even put 5 minutes into your agenda at the end. You have a captive audience, you can really get that evaluation from them then. You really get a high response rate versus if you had sent them something afterwards. And then a paper survey that you would mail to people, post office mail. This would be something where you have limited information on contact. So it could just be that you're trying to survey a zip code area, so you don't have people's names or their contact information other than a list of addresses that you can send mail to. It could be also that you are interested in a certain position within an organization. So say you know where the child care facilities are in your community, and you just want to survey the directors of each of those communities, so you can send that. That would be what would be good for a mailed paper survey. And then phone surveys are helpful if your topic is complex, if you need a staff person or a trained person to walk somebody through the content and really assess those behaviors or frequencies or whatever. And of course, that is often met nowadays with a challenge with phone numbers, because a lot of people use cell phone numbers, so you have to really think about how you'll get those phone numbers. And then finally, online surveys are really used a lot now. They're really easy to send out, mass distribution. The data is available. All you have to do is click export. There's not that delay in data entry period. But it does mean we need access to somebody's email address. We also need we need somebody to click a link somewhere. So it could be that you're promoting it through a social media platform or something. But either way, that's the online survey. Oh, and now I'm going to do a little show of hands, and Renee will tell me how many of your hands are up. How many of you currently use or have used online surveys for your program evaluation? So go ahead and raise your hand if you've used an online survey platform for evaluating your program.
So you've got some hands raised. Right now, about 50% of those who are on have their hands raised. Yeah.
And the rest might be eating lunch, who knows?
Right.
Okay, great. So I figured a lot of you would. Here I just grabbed some of the most common ones that I come across a lot. Just kind of put some pros, cons, costs. And really all of them offer this free account that you can use. It's really limited though. It usually limits how many surveys you can have going on at one time. It limits how many survey participants you can collect, or how many responses rather. So I would suggest, if you have it in your budget, to at least upgrade to just the next level. A lot of them are like $25 a month, something pretty doable depending on your budget. And if the budget's super duper tight, you can always look at Google Forms, which actually is really user friendly. The downside is it would need to be an anonymous survey unless you're going to actually ask the participant to like put their name or something like that. And then of course it has a lot of limitations on the type of questions you can use. It's not as complex. You can't use as many skip logic patterns, things like that. So now you've kind of decided on the survey. You've decided what kind of survey you're gonna do. Now you really want to think about what's going to go in your survey. So the first thing you really want to do is go back to your evaluation questions. That's where you start. You want to narrow down to your key indicators. A lot of people use this funnel approach. So you take a broad concept, you narrow down all the way to the exact survey question. How are you going to measure that indicator? So it's also helpful at this stage to do some backward mapping. And that's looking at, or thinking about rather, your end product. So think about your final evaluation report. What's it going to look like? What types of things are you going to report? How are you going to word your results? And then you can even draft bullet points for like an executive summary. This helps you think about what data you want to report, how you want to report it. It might help you think of additional items that you need to collect in the survey in order to give those results in your final report. So if you haven't already, you should have, but if not, you should really involve your partners here. This is really important, especially if you're going to be co-authoring any kind of report. They may have a very specific idea in mind on what they want to report or how to report it. So this can help you think about your measures. And then chances are you're not the first one to collect data on this or on this issue. So when you can, look for existing items or scales. You can look at national surveys, see what kind of questions were used to assess that the issue or the topic that you're that's in mind. And then always ask around to colleagues and partners. See if you can get examples of similar surveys from other people. It's just helpful not to reinvent the wheel. So next we can just kind of review some common types of items. And again, this is really review. We've all taken surveys. We've seen these questions before. We may have not thought about the pros and cons of each and how we can use them in our survey, but it's helpful to revisit. And so, for example, if you wanted to know the percentage of your participants that used the different types of social media platforms, say, you wouldn't want to put that in an open-ended question. You don't want to ask them what kinds you use. Be more efficient, especially on the analysis side, if you put that into a multiple choice question where each social media platform is listed out and they can select all, or maybe even an other where they can write in any other that they that you missed maybe. And then ranking questions, actually back to that example with social media, this might help you narrow in on really the most important. So a lot of times with select all, it kind of depends on what you're trying to report, but if you're trying to understand what the most commonly used platform or whatever it is that you're trying to assess, you can use a ranking question to really get at that. So you might say, rank from 1 to 3 the most, the platform that you use the most. And that's actually a little bit more, gives you a little bit more information that you can actually use, gives you more understanding of what people are using more commonly. And then for the rating scales, again, these are super familiar with probably everybody. You've taken these in surveys before. On a scale of 1 to whatever, rate something, your agreement, your disagreement, your satisfaction, whatever it is. It's a helpful tool to measure the extent to which whatever you're measuring. It gives you degrees, some variability there. So those are super helpful. And with that, you can measure, like I mentioned a few, but here's a really helpful resource that has a lot of examples of those rating scale anchors. I personally get tripped up on frequency a lot, and which categories to put in those. So I always go back to this when I'm designing a survey. Okay, so here's some tips. These are maybe do's and don'ts, I'm not sure, of designing a good question for your survey. So on the right-hand side with the grimace emoji, you can see these are what I say are some rotten survey questions. So you want to be specific. You want to define your terms. So on the right, you see it says, how many ounces of sugar-sweetened beverages do you consume per day? So we in public health know what we mean by sugar-sweetened beverage, but the general audience that you are surveying may not. So I would consider that jargon, and you really need to define what you mean. And, avoid leading, loaded questions, double negatives, double barreled. You've heard these before, I'm sure. And really define those time frames. If you are asking somebody about a training that they completed, then you need to say that. Say, since the training that you completed on such and such a month or whatever, have you done X, Y, or Z? Or, was it in the past 2 years, have you done X, Y, or Z, or 2 weeks, 1 week, 1 day, whatever. Time frames are important. And then make sure that your survey item is going to elicit variability. So a classic example over on the right, are you against drug abuse? Well, I hope so. But it's an easy and a common mistake, and we can catch that in survey testing. A lot of times we do. If it's a question that's just, you know, you can see that most people will agree with, then it's not going to give you much information. So it's kind of a useless question. So we're going to play a little game. I'm going to let Renee tell you what we're playing. Renee, do you want me to ask the question?
Oh goodness, sorry. I was on mute. I'm sorry. Oh goodness. Okay, so quiz time. Which survey item is rotten? Which one's the bad question?
Renee?
Yes, I'm here.
There's actually 2 bad questions, but that's okay. We'll see.
Yeah, we'll see.
Select one of the 2 rotten questions.
Okay, we've got 9 respondents. I'm going to go ahead and end, and we'll share the results. Okay.
Okay.
Rebecca.
So, yeah, I can talk about it.
Yeah,
So
yeah.
the first one is really, you are asking, it's double-barreled.
No, it's not. I'm gonna push back. It's not double-barreled. It's the use of or. How helpful or unhelpful. So this is a scale. This one's not double-barreled.
Okay.
However,
you tell the other one too.
Yeah. However, this one is. Why? Because this is an and. How satisfied are you with the content and the pace of our training? There's 2 questions there. How satisfied are you with the content? Question mark. How satisfied are you with the pace of our training? So this one's actually the rotten one. We kind of tricked you. I know that or in there. Okay, I'm gonna stop sharing and I'll get back to Rebecca. Sorry.
Okay, sounds good. We try to make this more interactive, folks, and we take a risk sometimes. Okay, so now that you've designed the absolute perfect questions, right? They're great. They don't violate any of those issues that we talked about. You really want to put all of your questions and map them out into your survey. So this is extremely helpful. This will help you see the logical order in which you have your questions. You want to make sure that similar questions are grouped together, that your most important questions are in the beginning. A lot of times, depending on the type of survey, people will trail off at the end. So you want those really key questions at the beginning. And then you also want to make sure that whatever you put in the beginning is obviously non-threatening and that are just easy to answer so people can start getting into the groove of it. Ensure smooth transitions. So you might include things like, now we're going to ask about, or something like, almost done, just a few more questions. And then it says place demographic questions at the end. I would say it kind of depends on your participant group. Depends on if those questions would be a harder thing to answer in certain participant groups. So now you have the order, you're ready to go, but you should definitely test your survey. And I have exclamation points. It's so important. I can't stress this more. So you want to make sure you include your target population if possible, or somebody that would be like your target population. And you want to make sure it's somebody that's not familiar with the survey itself. So even here within our research center, we'll include other people that don't work on our projects just so that they're not in the weeds on the survey and the language that we're using, so they can really help us make it clear. For web surveys, you're obviously going to want to test your web browsers. You want to test it on different devices. You want to test your links. If you're doing panels, you want to test those panels. And then you want to export dummy data. Renee, I'm seeing a couple chats come through. Is that for me to answer?
I think it's okay. I think you can keep moving along. Some
Okay.
of it's logistical and some of it's just some good feedback in general that I can share momentarily.
Great. Okay, great. Just alert me if it's something that I need to address in the moment. So
I will. Thanks.
okay. And then, so that was for web testing. And then if you have, paper survey or a phone survey, you want to test your scripts. So make sure how you're introducing the survey, how you just elicit participation is clear to folks. So then after you're done testing, and maybe part of your testing is included in this, but you want to plan your process out. So here I just have an example. This is from a web survey that we've done. And so just a nod to that, it might look a little bit different if you're doing a paper survey, phone survey, but in general, it's helpful to map out when you're going to start, when you might do reminders, when you might do phone calls. And it's also helpful to note important dates. So in this case, we were doing a national survey for the National Association of Chronic Disease Directors. So it was important for us to note if there's government holidays, if there was like a national conference that would have affected when participants were there, especially since we're calling people, we want to catch people in their office or whatever. So that can help you as you plan your survey process. And then just for us, as you can see, our typical online survey process from start to finish is about 6 to 8 weeks. So then you want to go ahead and make your survey live, or you're sending out your surveys in the mail, or you're starting to call people. And for web surveys, you really want to try and monitor. You really want to look at how the data is coming through, similar to what we did in the testing period, where we can see if the skip logic is being, if something weird is going off the skip logic, or if questions aren't being answered. Or I've caught a lot of stuff this way, so I really highly suggest it. I remember one time we had a survey and we kept getting, for some reason, people wouldn't select one option, and it come to find out because a participant sent an email to let us know that, okay, they actually, for some reason, could not click on that particular option. So it was helpful to know, and you can fix it early on versus when you're all done collecting. And then keep a document with any notes that you have during the process. So it could be that you are excluding somebody either because, you got an email back from them that says, hey, I don't work here anymore, or, this doesn't apply to me, or I'm on maternity leave or something like that. You can keep a note about that. And then the online web, they have a place for you it will track your participation and your response rate, but I would suggest keeping an Excel sheet just so you can set it up the way you want. I'm going to start going a little faster, Renee, because I see that we're up on the 50-minute mark. So increasing your response rate, you can do several of these to try and do that. Obviously, we emphasize the importance to our participants. We keep it really short. We keep it easy to use, user-friendly. If you can provide an incentive, that's great. We use that a lot. Even if you can't provide it to each and every participant, you can enter them into a raffle to win, one of a couple gift cards or something like that. And then for us, we do a lot of reminders and phone calls, and that's mainly because a lot of our participant group, we have that information, but that may not be the case. And then you want to decide when to close your survey. So it could just be that you have a certain response rate you're trying to get, certain number of people. Maybe you just have a report coming up, so you just kind of have to close it and go with what you have. And you want to clean. So this is where you look for duplicates, make decisions on how you're going to handle participation, partial participants, people who completed only some of the survey. And then for us, we do a lot of cleaning the data as far as making variables that are going to be helpful for us in the analysis stage, like grouping Likert scale options. And then when you are going on to your analysis phase, you want to think about your audience. Obviously, you would report something different to your funder than you would to the general public. And you also may think about just the level of stats that you would need, and that may go back to your audience. And perhaps you have a couple different audience groups you have to do, and that's, you know, you might have to do a little something different for each one. But for the level of stats, you know, us at the Research Center, here we do a lot of stuff for scientific publications, so we're a little bit more concerned about p-values and rigorous stats, but, you know, you really just want to do whatever is going to be needed to understand your program. So it could just be that you can group stats by different groups or compare across time. It just kind of depends. And then if you're going to do something more than once, if it's an annual survey or something, definitely a report is helpful. I mean, a template. So here's an example template, and I'll just kind of go through this pretty quick, but you might just introduce the survey and your participants in the first section, and then really hit back to your survey goal, your survey purpose headliner in section 2, then make any crucial comparisons in section 3. And then in section 4, you really just want to say what this all means, what are the implications, and maybe you're pointing out that your, I'm sorry, I lost track of what I was saying. But anyway, that's really important for portraying the success of your program, and or maybe pointing at places where your program might need improvement. Okay, so really quickly, I'm going to show a brief example on a pivot table. I find these to be super helpful. Yeah. Let's do this new share. Okay. So here you might have some data that you want to analyze, and so you have your variables up top, you have your participants here, you have your age category or whatever it is, you might have your yes/no type questions, your categories of whatever. This is totally made up, just an example. But the pivot table allows you just to kind of make these 2x2 tables really quickly in the analysis stage. So you can highlight all the data that you want to include. And that doesn't include it all in one, it just gives you those options later, and you'll see what I mean. So you want to insert your pivot table. This just tells you which ones you're selecting, yes. You can either put it in a new worksheet or you can add it to the one you have. I always just put new worksheet. So then it pops up here, and on the right hand side, you'll see this is kind of where all the magic happens. So say we want to know secondhand smoke exposure by age. So we take this H and throw it into the rows. You see over here, the labels will show up. And this blank one is just showing you if there was any blank categories. We can just pull that out like that. And then you want to take your smoke exposure and you want to put that into the column section. So you notice there's nothing populated here right now. That's because we haven't put anything in the values. So now I'm going to grab smoke exposure again. I'm going to put it down into the value section. And then here you are, a 2x2 table, really quick and easy. And I know a lot of times though we need it in percentages. And so what you can actually do here is change that. So you can say you want to show, like right now it's shown as a count. So it's just counting those yes and no options. But say we want to know the row percent. So we can go down here, there's a lot of options. This one makes the most sense to me intuitively. But you can see, so of the age group 15 through 17, 45% were exposed to secondhand smoke, as opposed to 42% in the 18 and up group. And overall, 43% were exposed. So hopefully that was helpful. I use those a lot in quick analysis. And that's all I have for the 9 steps of the survey process. And we'll get to questions here in just a second. I just want to mention some limitations of the quantitative data. And this is almost setting up for the next webinar that you all will do on qualitative data, because some of these limitations can really be not enhanced, but addressed through qualitative data and using both of those types of data together. So of course there's the limitations of missing data. So if it's a survey that participants are filling out themselves, they may not fill out certain ones that are sensitive. They may skip some. And then if it's something like a document review, like Peg talked about earlier in the webinar, if you're doing document reviews at sites or clinics or something, some sites might not report all the information the same way as others, so you may have some missing. We have reliability issues there, validity issues. All of these can be handled a lot of the time in the testing phase. And so just another reminder and or stress of testing your survey and or testing your quantitative data collection way of doing it. So if you're doing observation data, do some pilot testing as well. So now I'm going to hand it over to Renee for the Q&A.
Yeah, so submit your questions or comments, because I've gotten some good comments. I think hopefully I didn't mess you up with the poll questions, the quiz questions regarding the survey. But yeah, I just wanted to point out the double-barreled, because that was something that, I don't know, maybe that might not be a term that's typically used, but essentially it's 2 questions in one, where you don't want to include the and conjunction, because in the case of that question, it was asking about the satisfaction or dissatisfaction with pace as well as content. And so those would be 2 separate survey items. I will say that the first option that use the conjunction or in regards to how helpful or unhelpful, I think that's not the greatest wording of an item, because as you could see, most people did choose that, and I think it can be confusing, the or and. So again, something to consider. We're using ourselves as an example of how we can refine our survey items when we test them with others. Okay, well, I don't have any questions, and there hasn't been any additional comments that have come in. So I'll just go ahead and thank you all. I really appreciate your participation in this webinar. We hope that it's been helpful. And we sure hope that you can join us for the next live webinar on Wednesday, September 18th, which is focusing on qualitative data. So really complementing the quantitative piece. We really would appreciate if you would take a moment to complete the post survey that will come up as you exit this webinar. It'll only take a couple minutes, and it will be very useful feedback for us to refine our webinars in this series. All right, well, that's it, everyone. This concludes our webinar. Thank you.